Hello, and welcome to our coronavirus guidelines and procedures video. So, as you can probably imagine, we are so excited to reopen and get back to seeing our lovely existing clients and all the new clients that we're going to be seeing over the next few months. However, we have had to put in place some processes as recommended by the government and our regulatory body. And I wanted to just take a couple minutes to explain what they are and why we're doing them. So I think when you know why things are happening, it makes a little bit more sense. So the first thing that we've needed to do is we are being asked to screen our clients 24 hours before the appointment. So what that means is we need to know if you're having any symptoms specifically before you come to see us, so we make sure that it's safe. In order to do this, I've created a form, and the link to that form is in your booking confirmation and your reminder. So the day before your appointment, you can go into your booking reminder, click on the form, that's the COVID-19 screening form, and it's going to take you about 5 minutes. It says, have you or anyone in your household had a fever, which is 38 degrees Celsius or above, a new continuous cough, or loss of taste and smell. At the moment, those are the main symptoms that they ask us to look for, and if they change, then we'll change the questions as well. When you submit the form, your therapist can check and see. If we don't get the form by the evening before your appointment, the therapist will have to call you either the night before or the morning of. So it would be really great if you could make sure that you fill that out the day before your appointment, so we don't need to worry about following up on that with you. On the day that you arrive, when you come in, we'll check your temperature again and record it. We are being asked to do that, to record the temperature of the clients that come in. We're going to ask you to take your shoes off and keep them by the door so that we're not bringing stuff in off the street, and wash your hands when you come in. We are providing hand lotion for our clients because you may or may not know that when you wash your hands continuously, it can dry out your skin, and dry skin, hand washing isn't as effective on dry skin, and antibacterial also dries out your skin. So you can put a little bit of lotion on. During the consultation, we'll stay distance, and there'll be markers on the floor to help you know where to stand for the posture assessment, the movement tests, and the discussion. If the therapist does need to come close to you, they'll stay at arm's distance when they're adjusting your shoulders or looking at anything. While in the treatment, the therapist is required to wear one of those visors, so like the plastic thing that kind of wraps around your head. According to the government guidelines, if one of us is wearing the visor, so because a therapist is going to wear the visor, it's not necessary for you as the client to wear the face covering. However, if you would feel more comfortable to wear a face covering when you're face up and on your side, that's totally fine. We will not be allowed to do any face work, so no massaging the temples or the forehead or around the eyes or the jaw. We can do the neck, but we'll just be kind of leaning back so that we're not over your face when we're working on the back of your neck. You will notice in the room that there are less soft coverings, so we're making everything as wipeable as possible. And we will have a break between every client to allow things to settle a bit and to clean and change everything that we need to. Therapists won't be wearing their clinic clothes on the way to the clinic. So they'll wear normal street clothes when they travel. And then when they get to the clinic, they will change their clothes, and all of their belongings are going to go away somewhere before everything gets wiped down. When you remove your clothes for your treatment, we do have a lidded box that you can put your clothes in, and that will be cleaned out between each client, so there won't be any cross-contamination with that. At the end of the session, we are not going to be accepting cash. It will all be card payment, or we can arrange for you to pay by bank transfer. And again, at the end, when we're reassessing, we'll do the distance as well. So if you have any questions about any of these guidelines, you can feel free to reply to your booking confirmation or your reminder, or a therapist can give you a call to discuss it. As things change, as the requirements change, we will be updating things. I'm going to be keeping track of this, and I've included the links below to the government guidelines that we'll be following. So if you want to read kind of some of where some of this stuff comes from and what the government's saying about, like the 24-hour screening or taking your temperature when you arrive, you can dig around a little bit if you'd like. I hope this all makes sense, and I hope that you feel, at the end of the day, it's our goal to make you feel as safe and comfortable as possible. So when you come and join us for a session, you can relax and enjoy the massage and don't need to worry about anything else. So thank you so much for watching this video, and we will see you at your session. See you later. Bye.